సో ఎలా స్టార్ట్ అవుతుంది మీ వర్క్? సో Ferty9లో ఎంబ్రియాలజిస్ట్గా మార్నింగ్ నుంచి మీకు ఎలా ఉంటుంది వర్క్ అనేది?
Morning when we go, we used to go, if the case is assigned, say the plan will be scheduled on the previous day only. Previous day the OT list will be given, and according to the plan, 1 hour prior we used to enter the lab. We'll check for the QA/QC, quality control and assurance. We'll be checking every equipment and everything will be done. Then later we will start preparing our OPU cases. Preparation will be done. Then before that we used to thaw the embryos for the embryo transfers. So that all we used to make it, and after pick up that OPU, then we used to wait for incubate for few hours, like 3 to 4 hours. So at that time, like what all the dishes we have to prepare, so that day 5 embryos what we get, that all we used to vitrify. Then later what all the plans, and when to start ICSI. So the preparation for ICSI, like we have to denude the eggs, that is the removing the outer cells of the ovum and make ready for the ICSI. We prepare that, then we'll start with ICSI. Then after ICSI around 3 o'clock we'll be doing our embryo transfers, and all for next day media preparation will be done after all works, then cleaning. That is our day.
In the past 10 years, what are the advancements and advanced procedures you have noticed?
Actually this embryo freezing and thawing are it was there, but it is like freeze all cycle and all was being practiced since few years, like for 5 years, since 4-5 years. So previously most of the doctors used to fresh embryo transfers only. So now this is like mandatory it became, because it gives better result.
So why is it, ma'am, like earlier it used to be 3-day transfer, now it's 5-day transfer, and also now the fresh ones are not being transferred and they are freezed, and the next day cycle they are going to getting transferred. So what's the difference and how is it impacts on the positive response of the patient?
Earlier it was day 3 transfer, because no equipments were available first of all. So for the culture condition of the embryo development, so we need a particular environment for the embryo development. So one thing is like infrastructure unavailability, and the other thing is like, at that time even we are not that aware that okay, this can we can do this day 5 and this will enter up in a good result, and everything that matters. This day 3 will give around 35 to 40% of result, and day 5 blast it will give the better implantation rate, like 60 to 65%. So day 5 will be the best transfer.
So till the day 5, what will be the stages of the embryo development? So what do you notice from the gamete to becoming an embryo? So what are the stages you will notice, ma'am?
Yeah, like we don't often expose embryos outside. Like we if we consider day 0, the ICSI day as day 0, that is the day where the ovum is picked up and the ICSI was done, or IVF was done. The very next day, like within 16 to 18 hours, we used to check for our fertilization rate. Once it is fertilized, then we used to check at 72 hours, like we'll check for cleavage, day 3. So later after that, on day 5, we used to check for blastocyst. So at that time, like on day 0, it will be only seen, only pronucleus will be seen. After 24 hours, the single cell will become double cell. And on day 3, it should be 6 to 8 cell. And on day 5, the cell number is like from 64 to 100 cells. So there you can differentiate the trophectoderm and the inner cell mass. So this is the difference between from what we observe from day 0 to day 5.
So if you get 20 eggs on the day 0, like during the ICSI procedure, like on day 5th, like how many embryos will be formed?
So if we get 20 eggs, that if everything is 20 M2, and sometimes if the quality of the sperm is good, so at least we used to expect 50%, 40 to 50% of the blast. So that means if we get 20 eggs, out of which we used to get at least 5 to 8 blasts. We expect that.